Kia ora, tēnā koutou, kolas Fairgray tēnei. It's really exciting for me to be part of the NZSTA advisory group and to be able to support all of you with the journey for helping children with hearing loss. I know that speech language therapy is an amazing profession where we've got so many areas of diversity, from older adults to young tamariki, and of course all those areas are fascinating. But for me, the area of children with hearing loss is the most dynamic and interesting. And I'm really fortunate that when I first began working as a speech therapist, I had 4 children on my caseload with severe to profound hearing loss. And as a new grad, that was a little bit daunting, but I had the support of advisor for the deaf and teacher of the deaf who helped me in that journey. So I hope I can do much the same with you. I learned so much in that first 5 years. I had reasons for deafness seemed to range from 2 congenitally deaf children, one who was born because her mum had rubella in the pregnancy, and the 4th one had her meningitis just under the age of 1. So I learned all in early age that there could be quite a lot of diversity, and from here decided I would do my master's in speech pathology and audiology. Not available here in New Zealand, I ventured out and went to San Francisco and had 5 years working and studying there before I came back to New Zealand. And I was very, very lucky that this occurred at about the same time cochlear implants were first being developed. New Zealand was early in the use of cochlear implants because we were so close to Australia, and this is the country where cochlear implants were really developed. So I was invited to be the founding therapist for the Hearing House, and whilst there I decided I would further pursue my interest in spoken communication for children with hearing loss. I became also a cert auditory verbal therapist. And even with children that don't have hearing loss, I put these 2 sets of skills together to provide therapy for children, because many of the skill sets do overlap. So I feel confident that I can really offer you some advice, some guidance, some support. I can work with you. I can do some work individually with you for specific tamariki, if you like, or I can talk about evidence-based interventions that are available for children with hearing loss. We can do that in group settings. Whatever kind of way that you need support, I'm really happy to provide it. I must acknowledge that I'm not at all the expert in New Zealand Sign Language, and for families who choose to use this as their primary mode of communication, I've got other colleagues who are I can refer you to for that. But either way, I hope that we can work together and really support these children and their whānau, and that it can be just a continuing learning journey for all of us. Ka kite anō.